they're trying to prove what causes a disease, they try to adhere to something called Koch's postulate, C-O-C-H. And what that means is if you find what's causing the disease and give it to a horse that is not sick, it will get sick with that disease. And that's how they say this is caused by this. So this is what I'm about to tell you has not been proven by Koch's postulates, but it's a high suspicion, and they want to figure it out. They have found that in North America, when a mare foals, it's a very stressful event. So under stress conditions, worms and intestinal parasites that are hiding in the tissues or encysted in the tissues are released during times of stress. So having a foal is a giant stressful time. So if you were to take that mare and deworm her in the first 24 hours of foaling, you'll actually kill different types of worms. One of them being Strongyloides westeri. You'll have to look that one up. It's a little tiny worm. But at the same time, they found that the foals at full heat weren't getting the typical diarrhea bottoms anymore. And they wondered if that's because Strongyloides is usually passed through the milk to the foals. And if it isn't, then maybe that's why these foals aren't having this full heat diarrhea. But they can't take and give the foals Strongyloides and make them have diarrhea at 7 days of age. It's just sort of the perfect storm of mom's hormones in the milk, possibly a worm infestation, and we're now 7 days old, and mom's getting ready to ovulate and clean herself up. So that's another aspect of this deworming that I encourage people that have mares that deworm them in that first 24 hours and with Ultramox or some broad spectrum dewormer, and maybe, just maybe, it'll just make life easier for your foal. But I can't prove why you want to do that. I can just heavily suggest it.
Yeah.
And so there's no, as far as I know, there's no papers or anything out on this. It's just something that was coming through it's kind of the university chats and such, saying this group is working on this, but this is a stumbling block. They can't prove it with Koch's postulates.
And do you think they ever will be able to?
Yeah, eventually, because we're getting into more and more nuclear medicine rather than let's take this giant bacteria, plunk it into this foal, and watch what happens. They'll actually start taking bits and pieces of the DNA and in cell tissues, etc., working on some of these theories. So they actually don't need to put things into horses anymore, or rats or mice, and they can work around it. So eventually, yes,
wow.
I think they will suss that out.
Yeah. And so, can you tell me about what you were saying with the resistance?
So in North America, Dr. Ella Mizuno, Dr. Chris Clark, as her supervisor, she did a thesis on roundworm infestation within horses in North America. So she went to some very large places where the PMU farms, pregnant mare urine farms, where they've got 600-700 horses that all pee to make our little birth control pills. And they looked at because these horses are very well kept, very well vaccinated, and very well dewormed. Except that when she started doing fecal egg counts on them, some of them had huge worm loads in spite of being dewormed. And a lot of the babies had huge roundworm loads. And so with these babies, they detect the loads and then treat them with the usual dewormers. Most times it was an ivermectin type dewormer. And they found that nothing was changing. The worm loads were just as high. And so they were finding a resistance. After 20-25 years of use of ivermectins in North America, the resistance had just finally started to occur. And so that lent itself a lot to going back to some of these really old drugs, fenbendazole, parenthal pamoate, and having a look at those. And they're still quite effective, but they're just not as popular because you have to dose a little more often. It's not a rapid kill and your animal's clean as a whistle inside. It's a little more, sometimes you have to treat them every day for 5 days to get rid of some of the bigger loads. And that also lent itself to that idea of the refugia, where you do fecal egg counts on your entire herd. The ones that are 200 eggs per gram or less, you just leave them be, so that those eggs, when they do encounter a dewormer, will recognize it as something that's going to kill them. And then you've got your gray area, those horses that are in the 200 to 400 or 500, wherever you draw that line, where you sometimes would do them, maybe sometimes not. The sometimes would probably be before you start feeding them in winter. I'm thinking of a Canadian winter where they're no longer having access to grass, etc. They're just on hay. And then there's those high shedders, the 500 to 800s and above, and you definitely want to just keep deworming those and hoping that their worm populations are coming from the naive group in the refugio.
And so with those higher ones, are they being done every 6 to 8 weeks?
Not necessarily. In North America, oftentimes they're just still being done what we call seasonally, and we have 3 months per season usually. And before you do them, you do a fecal egg count. And if at any time your high shedders are moderate to low shedders, leave them be and just wait it out.
Awesome.